Hey everyone, and welcome. Today we're going to tackle a really common concern, that mystery pain on the right side of your stomach. What is your body actually trying to tell you? Let's dive in and figure it out.
You know the feeling, right? You get a weird twinge, maybe a cramp, or even a sharp ache on your right side, and your mind just starts racing. What could that be? Is it something serious? Well, that's exactly what we're going to break down today.
And trust me, if this sounds familiar, you are so not alone. It's one of the most common reasons people feel like something's off. Sometimes it's nothing to worry about and it just goes away. But other times, it's our body's way of sending up a flare, an important signal we need to pay attention to.
So, to kick things off, let's get on the same page. What are we really talking about when we say right side abdominal pain?
See, right side pain isn't just one single feeling. It can show up in a bunch of different ways. It might be a sharp, sudden jab, or maybe a constant dull ache. It could feel like a cramp, or even a burning sensation. Each of these feelings is actually a clue, and learning how to read them is step one. To really get to the bottom of the pain, we first need to understand the neighborhood where it's happening. Think of the right side of your abdomen as a really busy city block, packed with several vital organs. So let's meet the residents, shall we? As you can see, it's a pretty crowded area. Up in the top right, you've got your liver and gallbladder. Your right kidney is kind of tucked away toward the back. Then as you move down to the lower right, you find the appendix, parts of your intestines, and for women, the right ovarian fallopian tube. A problem with literally any of these can be the source of the pain. Okay, so we know what's there. Now let's talk about what can go wrong. We're going to run through some of the most common culprits behind that pain on your right side.
This list really covers a huge spectrum, doesn't it? You can pretty much group these into a few categories. You've got digestive issues like gas, appendicitis, and gallstones. Then there are problems with your urinary system, like kidney stones or a UTI. And of course, it could be something as simple as a pulled muscle. The key is knowing how to tell the difference.
Let's really look at this comparison because it is so important. On one hand, you've got gas and constipation. Super uncomfortable for sure. You get bloating, cramping, but it's generally manageable. On the other hand, something like appendicitis is a completely different animal. Classic appendicitis often starts as this dull pain near your belly button, and then it moves, becoming a severe stabbing pain in your lower right abdomen, often with a fever. That's a signal that demands immediate attention.
And this brings us to a really key idea. The pain itself speaks a language. If we can learn to interpret the signals, the type of pain, how intense it is, and where it's moving, we can get a much better idea of what's really going on. Think of this table as your own personal decoder ring. Notice how a severe stabbing pain points towards something acute, like the appendix or kidney stones. A dull ache might suggest something like a muscle strain or maybe a liver issue. A burning sensation? That could be related to stomach acid. And if the pain travels or radiates into your back, your gallbladder or kidneys could be involved. All right, we have mapped the area and decoded the pain. Now for the most practical part. What do you actually do about it? Let's talk about prevention, and most importantly, when it's time to seek help. Now, while we can't prevent everything, these habits can make a huge difference. For instance, staying hydrated, that's number 2, is probably the number 1 way to help prevent painful kidney stones. A balanced high-fiber diet and avoiding overeating, that's key to preventing gallstones and common digestive issues. And staying active and managing stress just helps your whole system run better. Okay, and this is the most crucial point of this entire explainer. While a lot of aches and pains will just resolve on their own, there are some really clear warning signs that you have to take seriously. This is your most important takeaway, so please listen carefully. First, just think about the pain itself. If it's sudden and severe, or if it doesn't go away after a day, it's time to call a doctor. Second, look for other symptoms. If you also have a fever, feel nauseous, or you're vomiting, that's a serious red flag. And finally, consider the impact. If the pain is so bad it's disrupting your life, if it's radiating to your back, or it gets worse when you move, don't wait. Those are signals you should never, ever ignore. So we'll end with this question. Right side abdominal pain can be anything from a minor inconvenience to a major emergency. The key takeaway here is to just be aware. Understanding the potential causes, paying attention to the specific symptoms, and knowing when to act is how you take care of yourself. So are you listening to what your body is trying to tell you?